On the Medical Watch, he got a heart in the midst of the pandemic. Organ donations have decreased during the COVID-19 crisis, but for one local patient, the timing and the transplant were a perfect match.
You don't think of you're going to get a call at 3:15 in the afternoon.
It was the phone call Roy Rowe had been waiting for. The 60-year-old was getting a new heart in the midst of the COVID-19 pandemic, a scenario he'd already discussed with his doctors.
They wanted to know where I was at. How was I feeling about the situation with COVID-19? Did I feel safe? If a heart was available, would you be willing to accept it? And I said, yeah, I'm ready to go.
So on May 15th, he made the trip to Northwestern. A buddy and fellow transplant patient drove him to the hospital.
As we rode into the city, I'm talking to someone who had gone through the transplant experience. It was almost like a pregame. So I was ready to go when I got there.
No, that's it. Thank you. Roy's road to heart transplant began about 4 years ago when he was diagnosed with congestive heart failure and cardiac sarcoidosis, a condition that attacked his heart and damaged the organ.
It's kind of a bad luck diagnosis, and it can also go under the radar. A lot of times people aren't thinking about sarcoid, and so they miss it for a while. And by the time you pick it up, a lot of scarring can happen in the organs like the heart. And that's what happened with him.
Roy spent about 2 years on an LVAD, a portable mechanical heart pump that helped him function better. But his transplant changed his life.
To go from the pump to a heart it's like night and day. It's unbelievable. I mean, I didn't know how bad I was feeling until I feel good.
Sitting up in the chair talking to us the following day, telling us how good he felt.
Northwestern Medicine's Dr. Jonathan Rich and Dr. Duc Tin Pham cared for Roy before and after his transplant. During the COVID-19 stay-at-home order, organ donations were down 20 to 30% at the hospital.
There was some apprehension among a lot of patients waiting for transplants coming into a hospital scenario for fear of being infected, which was unfortunately not correct, but it worked out for Roy. I don't know exactly why other recipients turned down that heart, but it worked out for him.
Roy's physical recovery has been remarkable.
I've been walking like crazy. It's been awesome.
But his thoughts are heavy for his donor's family.
Right away, when people hear you're getting a transplant, it's congratulations, congratulations. And I had a hard time receiving that because, there was a donor involved and that donor passed. And I think my thoughts have been, even 2 years, 3 years leading up to this, I've been thinking about the donor and praying for the donor, praying for the donor's family, because without the donor, I wouldn't be here.
Roy is now back at home continuing his recovery. He says he plans to write his donor's family a letter once a year passes and he's allowed to reach